Thank you for tuning in to The Political Soup, where you hear editorial about the issues of the day and political philosophy. Your hosts are Nick Alex, our progressive, Dana and Pugh, our conservative, Paul Laws, our classical liberal, and here is our moderator and your host, John Toll.
Hello again, and welcome to the Political Soup podcast. My name is John Toll, and I'm the moderator for the event. Below we have the usual guys, Dana, Nick, and Paul, and if you don't know which side they're on by now, you will shortly. Tonight's topic is about Obamacare, specifically government health care, whether it should be available to all for free, what does free mean, that kind of jazz. And one of the things we're looking at is an article from thehill.com, which Paul will post down here when he gets a chance to do post-production. Thanks, Paul. And anyway, on Health Watch, the Hill's healthcare blog, they talk about support for government guarantee of healthcare hitting record low. And basically what it's talking about, I'm not going to give exact numbers because it's a survey, so who knows whether those Gallup polls are really accurate or not. But basically the gist of it is that support for government-sponsored health care in the way that Obamacare is worded is dropping or diminishing. And again, I don't know whether that's exactly true, but that's what the polls are saying. So I'm going to start out with Dana on this one, and I want to get your opinion. I just want to talk about Obamacare in general, your thoughts on the positives and negatives, if you think there's any on either side, or if you think it's all one-sided or not. So what are your thoughts, Dana?
I'm sure I could find some positives somewhere, however minute, but nothing's coming to mind. I think it's extremely misguided. Just the whole idea that the government stepping in can make everything right. I think that there is scant evidence in history and throughout the world that, in general, that the government can fix these kinds of problems, and more specifically, that governments can provide healthcare solutions. I know this isn't exactly single-payer healthcare. I think it's the first step on the way there, but certainly looking at other countries that have tried single-payer healthcare, I don't think it's something that we want to emulate.
And do you want to describe single-payer healthcare to the audience? I'm sure there's some members that don't know exactly what that means.
Essentially, to eliminate any private health insurance and to have all government-funded, taxpayer-funded healthcare. Everybody.
That's not what single-payer means.
Is it not? Did I get that wrong?
Single payer just means that there's a single payer for the actual bill, so that a doctor or a hospital or a medical provider provides a bill, it goes to one place for payment. So instead of current system where insurance company pays part and then the actual patient pays part, you're having one place pay it. So you could have that arrangement under a government program, or you can have it under private insurance as well. It's just how
essentially monopolistic healthcare.
No, that makes. I understand what he's saying. It could still exist under private industry and private insurance. I misspoke then. I meant government-run healthcare. Basically, I think I've only heard single-payer healthcare used with respect to government single-payer healthcare.
That's true.
So sorry, I've mixed the terms there, but yeah, essentially any kind of government-run centralized healthcare system, I don't think there's any evidence that it'll work. And again, in general, I mean, you can look at all kinds of areas where the government has involved itself in our lives, and I really don't see any positive arguments for bringing it into the healthcare system.
Well, let's jump over to what Paul was saying, and Nick, of course, I'll let you address all these points in a second. But Paul, you were saying monopolistic, and let's just talk about that one point in relation to the specific topic of single-payer healthcare. Now, you say it's monopolistic. Why do you say that?
Well, it's really quite simple. I mean, if there is one payer, if one person is getting all the business, that's a monopoly. Whether that entity is a corporation or whether that entity is the government, it's still a monopoly. They are the only ones that are allowed to do business with doctors, etc. I mean, it's a monopoly. It's monopolistic.
All right, and Nick, do you want to address that point and say, because you were about to say that it's not exactly monopolistic?
No, I wasn't going to say that, and I guess I really wanted to address Danon's point. I mean, the way to think about I mean, a couple. I guess there's a couple points I'd want to make. First and foremost, having a government-sponsored health insurance pool is different than socializing medicine. We're talking about the mechanism for paying for people's health care as opposed to the mechanism for providing it. So very different concepts first. The second thing I would tell you is that there are plenty, if you start to think of health insurance and granting access to health care through health insurance as part of the social safety net, there are plenty of examples of programs that are part of the social safety net that have worked. You think about things like unemployment insurance. You think about Social Security. Think about Medicare for seniors. Those are all social safety net programs that A, are incredibly popular, and B, have been very successful at granting safety and access to people. Since
And
they
broke.
were. They're not broke right now, Paul. They might be
broke.
trending. They're not. They're actually paying 100% of their benefits as of right now. So they may be
with
scheduled.
borrowed money. I mean, they're
Actually,
broke.
no, they're not.
Yeah.
They're not borrowing
Yes.
money.
Yes,
But they're
borrowing
not.
money.
You could
Guys,
you could
They
say
are.
that, but that's not true. And they're paying 100% of their
There's
benefits.
$42 trillion of unfunded liabilities out of Medicare. There's $22 trillion rather of unfunded liabilities out
And
of
those are
out of
future liabilities.
Social Security. They're broke.
But again, they are currently paying 100% of their benefits as designed. They are taking in more money through taxes right now than they're paying out. And yes, if you look into the future, if you hold the tax rates where they are right now, there will not be enough money in the future when that shift happens. But that doesn't mean that they're broke right now. And there are ways to fix it.
Well, guys, let me ask for a clarification. What's your definition of broke? And let's start with Nick.
My definition of broke is when you can't pay the bills that you have.
Okay, so you don't think of it as current like bank account status being zero, negative, or positive.
No, it is when you cannot pay your bills. That's
Okay, so
broke to me.
So as long as somebody will keep giving you loans, you're not broke, right? I'm not being facetious. I'm asking.
No. I think I get your point. I mean, at some point you would have to say, yeah. I mean, if people are continuing to give you money, then yeah, I guess that's probably true. But I wouldn't characterize the way those programs are right now as being in that situation. They are pulling in more tax revenues than they are spending right now on current benefits, and to me, that's the definition of not being broke.
Okay, well let's delve into this a little further then, because you said that while they're at a net positive, they're gaining essentially right now. If that's true, why is it in the future that they will run out of money?
Because the population is aging, and there will be more people drawing down on those, drawing out of the fund than paying into the fund, unless we somehow change the dynamics. Either population has to get younger, we have to employ more people at home, or we're going to have to change the way we fund those programs.
Okay, well, and the next question would be: is there a projection, based on the information that you've seen, and I'll get to you, Paul, in a second, that says about when they think this bottom is going to happen, if nothing changes?
If nothing changes, I want to say that's in 2024, Medicare starts to run at a situation where they cannot pay 100% of their benefits, and I can't recall Social Security. I think it's a little bit later, but it's not. I mean, these things are not that far off. I mean, maybe between 10 and 20 years out.
Okay. And Paul, does that coincide with the things you've heard? I mean, granted, I realize that by your definition, it's broke now, but have you heard anything about where it's just going to get to the point where it won't work, period?
Well, in the Obamacare bill, there was a specific amount of taxation that was created for the sole purpose of paying back doctors because they couldn't pay them before. We're broke. I mean, the programs just are not sustainable. They're broke. We are at the point that we can't pay our bills. We have been there for a long time, and we continue to go down the road of borrowing money, and we continue to go down the road of more taxation, and we continue to go down the road of expanding the dollar, which is essentially a tax on future generations. It's just not sustainable.
Okay, now I'm getting two different stories here, one from you and one from Nick. And Dana, have you heard numbers that coincide with either Nick or Paul's information?
I don't know. I hear so much conflicting from either side.
Yeah, and this is my problem as as a moderate person, is that I hear these things from people that I trust on both sides. Who's right? And how is it possible that there's no way that they can actually come up with a real fact that everybody can agree on? I mean, how is it possible that Nick has information that says that it's still got some time to go unless things change, and Paul, you're saying that you've heard definitive information that it's already failed, there's doctors that haven't been paid, therefore it's not been paying 100%, as Nick says it's got to be at less than that, but yet Nick is certain it's been paying 100%. So how do we resolve this complete conflict in information? I mean,
talk to a doctor.
Well,
we can't.
It's really simple.
No, because what you're conflating, Paul, is the fact that the government is setting rates at which they will do business with doctors, and doctors can choose to take Medicare or not take Medicare. They don't have to see Medicare patients.
There's one issue with that. I'm not talking about the government setting the rates that they will pay. I'm talking about the fact that they set the rates and then they pay under that. And it's a fact.
I haven't seen any evidence of that, and I guess if you could point that to me, then I'd like to see it. But again, we're seeing,
within Obamacare, there was a huge payback of the doctors. They had to do that in order to fund Medicare. I mean, it's just look at the bill.
I'm looking right now at the CBOE, or the Congressional Budget Office's projections for Medicare, and again, it shows nothing but that it's currently paying. It's paying what it's supposed to pay right now. So I don't understand how you could say that there's something in the bill that doesn't need to be addressed if you're actually paying 100% of the benefit.
And Dana, what were you going to say?
Wasn't this supposed to save all kinds of money when it was passed?
It's supposed to slow the rate. Supposed to slow the rate of growth of healthcare. I mean, healthcare grows double digits right now every year annually. The cost of healthcare is growing double digits.
That's because there's a third payer. There's no way. I mean, when you're not paying the bill, it's really easy to go in and say, yeah, insurance will take care of it. Well, now it's going to be easier to do that, and more people are going to be doing it.
Yeah, something that occurred to me the other day, in that looking at New York and Bloomberg's getting involved in sugar consumption and soft drinks and all that. And I think what they typically use to justify that is, it'll keep down healthcare costs. And that's kind of, I think that's typical. That's what we're seeing in that first we have the government say, well, we have to cover people because they can't cover themselves, and we can't just let people suffer, so we have to come in and provide health insurance for those who can't help themselves. And then once they do, then they say, well, we can't afford this, so we need to eliminate smoking, and we need to eliminate sugar consumption and all that, and it's just a slippery slope, I guess. I hate to say slippery slope, but one thing leads to another, that we start out with good intentions of helping the less fortunate, and it really comes into government control. That the government now is wanting to get involved in the lives of people who can afford insurance and can and have been providing their own insurance. And the next thing we're going to see then is the government forcing mandates on the people who can't otherwise afford their own treatment, either insurance or direct treatment. But the government's still going to come in and say, well, we need to keep down costs and start to regulate what we do, what we eat. I don't mean that in a draconian black helicopter way, but I mean we're seeing that in New York with sugar consumption. I mean,
yeah, but I guess that brings up the point of the mandate, right? That's one of the things that's really unpopular about Obamacare. But the idea of risk management pools are, in order to make them work, you need to have both healthy and sick people in it. And what you don't want to have is a situation where somebody says, I don't want to be part of the pool, ultimately gets sick and doesn't have the appropriate coverage and has to go to the hospital and get care in order for them to continue to live. So it's an ethical dilemma, right? That you're not going to deny somebody treatment if they need the treatment. We shouldn't be doing that. We shouldn't just choose to let somebody die because they doesn't have insurance coverage.
Yeah, we haven't been. That was the law before Obamacare, and even without the law, I don't know a lot of hospitals that would turn people down at the door because they don't have insurance to turn them down for life-saving treatment.
But that's a very expensive way to treat health. It's a very expensive way for somebody to get really sick to all of a sudden show up without insurance at an emergency room. That's not an efficient way to deliver health care. So in order to make this work, you have to have healthy people in the insurance pool. And this is not the first time we've mandated insurance coverage. Everybody who's employed pays into the unemployment insurance pool. You do, I do, if you have a job.
At the state level.
Doesn't matter. It's still a mandated insurance pool. So if you want to sit here and fence whether it's the state or federal government, that doesn't really matter. It's a government telling you that you have to buy a product. You have to have insurance for unemployment insurance. If you cannot decline it, you have to have that tax taken out of your paycheck. So the idea that this is some brand new concept that somebody has forced insurance company or insurance coverage on somebody for the very first time. The only difference here is you have the requirement to have health insurance whether you have a job or not. That's the only difference.
Well, and the other difference, of course, is it's at a federal level. Although, with the same school of thought that we're going off of here, I have a better idea. Instead of making it necessary to have insurance, why don't we just make it so it's illegal to get sick? That's equally intelligent.
No, it's not, and that's a bit of a red herring by you, right? I mean, you're just trying to be confrontational on it, but you can't mandate that, right? Don't get sick.
Well, of course you can't mandate that, and you really can't mandate that people have insurance either.
Sure, you can.
Well,
we have a law that does it now.
They did it, yeah. But the
and by the way,
you
are incorrect that you also have federal. You have both FUTA and SUTA, which is federal unemployment tax and a state unemployment tax. So you do have coverage at the federal level for unemployment insurance.
Unemployment is not a product; it's a check that you get. When you get unemployed and you apply for unemployment insurance and you get a paycheck, not a paycheck, you get an unemployment check.
Right. You pay into an insurance pool while you have a job. The only time you would claim benefit is if you lose the job.
But healthcare is quite different in that there is an entire private industry, as well there should be, around health insurance as far as what plans are covered, how much you pay, how much you get back, how much what kind of services it covers, not to mention the actual service, the actual health care, what doctors you go to, what kind of preventative treatments you get.
There's private unemployment insurance. You could. I mean, I have insurance for disability, for example. I mean, I could lose my job because I couldn't perform it. Something happens, and all of a sudden I couldn't do that. I mean,
let's be honest here, though. Government competing with private enterprise is like it's insane. Private enterprise cannot compete with somebody who forcibly takes money, because I mean, essentially, the government has a gun to say, you give me your money, and private enterprise has to say, I give you benefits for giving me your money, but the problem is, they can point back and say, well, I already have this because they're forcing me to do this.
Yeah, I know. That's by design. So it's not because the government is forcing you to pay. It's because the government doesn't have a profit incentive that the private industry does.
Yes, they
I
do.
don't. No,
Yes,
they don't. They don't. No,
Of
it
course
certainly
they do.
doesn't. They don't have
Of
to.
course they do.
They don't have to take 20% or 30% of every dollar of revenue that they've come in and provide it to their shareholders to provide shareholder value. There's no profit incentive. There's no profit motivation in the government-run plan.
Well,
Right, and then
guys,
without the profit motivation, then you also lose the motivation to satisfy your customers.
and let me get back to that. Let me step back for a second, and I'm going to give this back to Nick for a minute. And Nick, I want you to talk about what the benefits of this are. In other words, why, in your opinion, is it that Obamacare or government-run health care is important, and what does it provide, possibly, in your opinion, that private industry can't? I mean, what are the reasons that they were wanting to address all these? What are the issues they wanted to address with Obamacare?
Well, I think it's one. The main driver behind it is access. Having access to healthcare, having access to preventative care, having access, to insurance. I mean, there are plenty of people before Obamacare that had absolutely no way of getting insurance because they have a pre-existing condition. That there are insurance companies that were unwilling to take the risk of having somebody that had been diagnosed with a heart defect, for example, because there would be highly likely that that insurance company would have to pay out benefits. So instead of taking on that risk, they would just say, you know what, I can't give you coverage. So we have an ethical and moral obligation to our communities and to our citizens to be able to provide them access to health care. We had a situation where private insurance was out there. It was providing access to most, but it wasn't providing access to all of our citizens. And if you were poor or if you were already sick, you probably didn't have the kind of access to health care that you would want, or actually not want, but need. And the private industry wasn't going to be able to help you there. So, we can sit here and it's absolutely true. We have a number of people that are not covered or cannot get covered, Paul, and you can think that the free market's going to solve those ills, but it couldn't. It wouldn't, because there was no money to be made there.
Okay, hold on, Nick. And Paul, go ahead and address the issue just specifically. How do you think private industry could correct that wrong if they supposedly hadn't up to this point?
It's not that they hadn't. They had, and they still do. Let's look at organizations like the Shriners hospitals. I mean, you go there, you don't pay. It's a free market solution to a situation that is not great.
There are 30 million some odd people before Obamacare that did not have access to health insurance, and I'm sorry, the Shriners hospitals couldn't solve the health insurance needs for 30 million people.
Well, there's a strong disincentive for those sort of things to exist at this point, and there has been for a while. But if there were an incentive, as there used to be years ago, then it would have solved them.
What's the incentive?
What do you mean, what's the incentive?
What's the incentive for those things to exist that they've been disincented to provide?
The incentive for those things to exist is really simple: to provide health care for people who are poor. And I mean, it's really simple. You act as if people are cruel and mean, and individuals are not that way. Individuals give money.
Sure, but
companies give money.
What's the disincentive? I don't understand.
The disincentive is
we call people mean?
No, the disincentive is a push towards socialized avenues and directions. And you may think this isn't the case, but it's happened. Slowly, government has taken over all of those areas that before a free market solution would have existed, a solution where there would have been a Shriners Hospital, or a situation where there would have been some sort of a free market entity like that would have taken over and fixed woes that existed
That's not a free market entity, though. That's
it
a
most
charity.
certainly is.
It's a charity.
Charities are free market.
That's something that springs up in a free market with people freely exchanging.
You can have charity. You can have a charity without having without having a free market or having a strong government or a strong central government. The two aren't mutually exclusive.
Well, of course they are.
Explain to me how. You just say that. You say that, Paul, as a matter of fact, and I don't understand how you can say that because we have charities today. Of
course, we have charities today.
Well, there are literally hundreds of billions of dollars given to charity today in this so-called, by you, very socialistic, government-controlled country that we have.
There are some places that the government has still yet to take over.
Oh, and those are the only places that get charity?
If the government is going to step in and say that everybody is covered for the health care, for their health needs, who's going to donate to charity anymore for health services? I think that's what Paul's saying, that as the government comes in and supposedly takes over a role, albeit poorly, but as they take over a role of the free market,
two things happen.
Charity's going to go away in that area.
Well, yeah, because two things happen. Number one, the government takes more of the individual salaries, so it becomes harder to donate to those charities. And the second thing that happens is individuals think, well, the government's got it, no problem. They're taking care of it. But they're not. They don't.
And I think that you guys are way oversimplifying your opposition to this then, because if you really think that because the government's providing basic health insurance to everybody that it's going to stop charitable giving in this area, then I think you're being disingenuous. There's absolutely no correlation to the two.
Not at all what either of us said.
Well, that's what I heard, is that if government is going to provide it for all, then people will stop giving. And I don't think for a second that's going to happen. No, it is not. So you're going to talk out of both sides of your mouth now. You said that's not what you said, but now you're saying that's a fact.
Well, you just defined something else, and that, what you saying that government providing the government doing the job of a charity is not going to destroy the charity. Well, that's just silly. Of course it is. That's what it does.
All right, guys. I think we've we've hit a wall here, and it's probably a good time for us to break down and end the show anyway. So appreciate your time, and I'm sure there's going to be some conversation below on this topic. It's a pretty hot one right now. Again, Dana, Nick, and Paul, appreciate all your time and coming in and sharing your opinions with everybody. And for the audience, please share your opinion below. We'll be back again soon. And the next episode, I'm sure, will be just as interesting as this one. So, again, thanks, guys, and have a good night.